Limitation of lateral movement in the left eye is abducens palsy in this patient. Patient has right eye ptosis and limited movement of inferior rectus, medial rectus and superior oblique, but pupil is reacting to light normally. It is pupil sparing third nerve palsy. Etiology is vasculopathy, whereas pupil involving third nerve palsy, it can be compressive or vascular lesion because pupillary fibers are located in the periphery. Patient has right eye ptosis and limited ocular movements, but pupil is mid-dilated, showing pupil involving third nerve palsy. Hypertropia in the left eye along with limited depression in the adducted position suggestive of fourth nerve palsy involving superior oblique muscle.
With just your eyes. And he has limitation of depression in the adduction of the left eye. Now we'll do a 3-step test. He's focusing on an object. We're going to cover and uncover. Keep looking at the object. And he has a right or a left hypertropia along with some exo deviation as well. Now we're going to have him look, turn his head, and it's a very large hyper. We'll turn his head to the right with his eyes looking to the left. And there's very little vertical deviation in this direction. Now we'll tilt his head to the right. There you go. And very little deviation. However, when we tilt his head to the left, we have another large hyperphoria on the left side.
Let us see the patient with Horner syndrome. You can see the left eyelid drooping, which is called ptosis. Another thing you can see here is there is like indrawing of the left eyeball. The phenomena is called ophthalmosis. And then looking at the pupil diameter, like there is a meiosis in her left eye. And then another thing is there is a loss of cerebrospinal reflex in Horner syndrome, which is normally there is a dilatation of the pupil on giving the painful stimulus. But when I am giving the painful stimulus in our left side of the neck, there is no dilatation of the left pupil. This phenomenon is called loss of cerebrospinal reflex. Another component is the anhidrosis, and there is a loss of sweating in the ipsilateral face area. So meiosis, anhidrosis, ptosis, loss of spinal function, and the ophthalmosis are the component of the Horner syndrome. The cause for the Horner syndrome are many. The main pathophysiology behind the Horner syndrome is the loss of the sympathetic ganglia functions.